Hi, welcome everyone to our Facebook parenting series entitled Help, My Kids Are Going Crazy. I'm Dr. Lisa Konick. I am a psychologist and founder of Konick Associates. We are a behavioral and family psychology practice with offices located in South Naperville and Orland Park. And we specialize in supporting families and children. One of our frequent approaches is to work with students and families with kids on the autistic spectrum and neurodevelopmental disorders. And today I have with me Colleen Hanson, who is founder of Core Connections Counseling, and we have some very similar clients in our group practices. And I'm going to introduce Colleen today. Today she's going to be talking about facilitating social skills development during this time of social distancing. And we are really responding to a lot of questions from our client base about how do we support kids and families during the time that we are sheltering in place, because a lot of our norms for summer are a bit jostled right now. We are not going to be doing vacations like we would. We're not doing groups. We're not doing camps as much. And so Colleen's going to be speaking to us about all of these questions that you might have. So let me introduce Colleen. Colleen Hanson is a licensed clinical social worker and founder of Core Connection Counseling, a practice specializing in anxiety, autism, ADHD, and other neurodevelopmental disorders affecting children, teens, young adults, and families. They provide individual therapy, parenting, family support, and a variety of social skills groups. She has over 20 years of experience working in a private practice, as well as in public, therapeutic, and private school settings. Colleen has a bachelor's degree in psychology, a master's degree in social work, and an educator license in school social work. Colleen utilizes cognitive behavioral therapy, mindfulness, and her current clinical focus on neurobiological and treatment, applying neuroscience to therapeutic interventions in parenting. She is certified in the Daring Way curriculums on vulnerability and shame resilience based on the research of Dr. Brene Brown. Welcome today, Colleen. Thank you for joining us in our parenting series.
Thanks, Lisa. I'm so happy to be here. I appreciate it.
I'm happy to have you. And I was mentioning we have a lot of families that are asking a lot of questions about how they can integrate social skills development into this summer now that things are different. And we'd love to hear from you on what tips you're having. Tell us a little bit about your practice and some of the things that you're doing.
Okay, great. So my practice, Core Connection, is located in Lisle. And as you said, we focus on children and work with families. And a big part of our practice is kids on the autism spectrum or kids with ADHD that are really struggling with social skills and social interaction and social engagement. So we have a variety of social skill programs, and I think the foundation of most of our programs are sort of based in that social thinking curriculum, which people may be familiar with. It was developed by Michelle Garcia Winner, and it's used in schools. Zones of regulation kind of came out of social thinking, so many parents may be familiar with that program from schools. And so that's really the focus and kind of our specialty within our practice. And, you know, I think coming out of this stay-at-home lockdown time, you know, the first thing that I'm sort of looking at with my clients and talking to my families about is really kind of seeing where their kids are. You know, I like to think about interventions as a little bit bottom up, so from the body up and then top down. And social thinking is definitely more of a cognitive curriculum and more of a top-down curriculum. But I think a good place to start is really just to observe where your kids are from a physiological standpoint, because we have a biological need for connection and social interaction. And when that need is not met, sometimes what we'll see is shutting down. And so that can look like an immobilized, you know, just not coming out of their room, laying in their bed, you know, not moving at all. And the other kind of physiological state would be fight or flight. And so we might see more arguing and irritability and anger and anxiety or frustration. And when you're in either of those physiological states, your body is not focused on social engagement or interaction. It's focused on survival and keeping you safe. So I think the first thing is to kind of recognize where your child is, just in general or at any kind of given moment, and then try to see what ways you can help them to kind of regulate that physiological state and move into that place where they're open and ready for social engagement. So I think that's one of the first things that we've been kind of focusing on. For those kids that, sorry.
I want to add something to that. I think about when we're doing social support with kids, either anxious kids, kids on the spectrum, kids that are sensorily overloaded. It's real, and I teach this to parents as I know you do as well. It's hard for kids to be focused on their social world when their internal systems are off. So we need to work on regulation, and I think that having some expected understanding of what's coming up, if there's a social expectation for them, might be very helpful. So, I if you don't mind, if you could speak to social stories and how that helps to regulate kids so that they know reduce their anxiety.
Right. Yeah. Well, and I mean, I think if they're more shut down, definitely physical movement is not compatible with shutting down. So I think getting them more physically active will kind of help to shift their state. And then really, social engagement really responds to just the social connection with parents or the relationship connection with parents. So I think spending more one-on-one time, doing more kind of connecting and sharing individually with kids can kind of help bring them back to more regulated state. And then you're able to better work on, like you said, some of those skills when their anxiety may be feeling, less intense or maybe manageable, at least where they can tolerate it, to work on or do some of those other things.
We've actually posted a few social stories for families on our website. I don't know if you have some as well that you suggest, but just kind of having that understanding of what's coming up can help kids to be a little more regulated so that they're more available to the social interaction that's coming to them. Like, I think about going to the museum, or which may not be doing now, or riding on the train, or what's going to happen when we go to this birthday party, so that they kind of have a sense of what might be coming. And then they can be more aware of some questions and their expectations for behavior. It helps to reduce some of that stress.
Right. The predictability, I think, for a lot of kids, especially in unknown or unfamiliar situations, or because they've just been out of practice, because they've been a lot, and haven't been engaging or going out and doing other things. So I think for some, just kind of re-entering the world and some activities is going to maybe be a little bit of a challenge, for some kids. So I agree, like, giving them a good sense of what to expect may help to kind of alleviate that. And even behavioral rehearsal, kind of practicing and role playing it before you go can sometimes be a good strategy as well.
That's a very good tip. One of the questions that we had from a number of our families, Colleen, were, one of our families had asked about, well, actually a number of our families have asked about Michelle Garcia Winner's work in the social thinking curriculum. And I know that a lot of parents may have had some of that exposure through school, because a lot of schools utilize that curriculum, but I think it can be a bit overwhelming for a parent to understand how to implement that at home without some support. Do you have suggestions on some language or some specific strategies in that curriculum that might be helpful for parents to understand to implement at home?
Sure. So their website, if you've been on their website, they have a ton of resources, and I totally agree. It can be totally overwhelming, and they always seem to be adding new things. One thing I'll just point out to start with is they have a lot of free articles. They also have a lot of materials you can purchase, but they have a lot of free articles. And during this pandemic time, they have posted like read aloud books that have like worksheets and things that you can download that go along with them. And they also have kind of some little mini talks on some of the main concepts and vocabulary from social thinking. So when I found those, that's, one thing that I've been kind of referring families to, because if they're interested in just learning more themselves or trying to work on some of these things at home, I think those are just amazing free resources right from them. So that would be the first thing, and I think when you think about social functioning, they have actually an article about the social competency model, and the foundation, other than regulation and physiological regulation, is social attention. And so I think that's their concept, thinking with your eyes, really relates to that social attention piece, and recognizing and helping kids see that we're not just looking at someone to make them think we're listening, but it's about getting information. And so thinking with their eyes and observation of people, observation of their environment, is a really foundational skill. And that's something that is so easy to work on, like all the time, whether it's, asking them questions, if you're in a new place or a new situation, for them to kind of observe, like, where do you think we need to line up? Or, where do you think we need to go next? And get them to kind of use their observation skills to figure out what's happening, what they need to do, what the behavior is for that situation. And then I think the other main thing is perspective taking, so social attention, and then understanding the perspective of others is a big piece of that. And, even within your family, working on things like, planning some activities, planning some meals, what does dad like best for dinner? Let's figure out what dessert he would like, or, and getting them to think about others, and through observation and thinking about others, then they can start to put some of those pieces together. But I think there'd be some really fun ways to just work on those skills within a family setting, just focused on even those two things.
That's a great tip. I remember working with kids in social group, and just the idea of the very basic about what are my eyes telling you. And I would it's like, what am I thinking about? And I would look at the chair, and they'd say, oh, you're thinking about, and your eyes are telling me what my attention is, and that's probably what I'm thinking. And if I'm speaking to you and you're looking at the cat, where do I think what do I think you're thinking? And that kids really enjoy that game, I think, as well. So that's a great idea. And we can do that at the park, even if we're not engaging with other people. We can people watch and think about, what are they thinking? What is this, based on the gaze.
Exactly. Yeah. And I just think, in practice with that is so important, and across settings and, a variety of situations. So, that's exactly, the type of thing that I think is a helpful, activity to focus on, to continue to build skill.
That's actually such a base skill too, that it's a great one to continue to work on all the time for a lot of our kiddos.
Right. And a lot of them have been told, like, you need to look at me or look me in the eyes, and they don't know why. And so I think helping them to understand that their job in looking is also to get information about what someone is thinking or feeling based on, their facial expression or their body language or where their eyes are looking. So I think all of those are really good things to work on.
Colleen, I actually have, that whole look me in the eyes thing is very interesting for a lot of my clients who have autism, because I've actually had kids tell me, would you like me to look at you, Dr. Konick, or would you like me to listen? And what I've just discovered over the years is it's actually very uncomfortable for some kids to look in your eyes. And so we teach them tricks, and I will, and I a lot of times will ask a lot of my clients that have difficulty with eye contact, is it difficult to look people in the eye? And they frequently will say yes. And one of the things that I've talked to them about is the tricks that we can look at. You can look at my nose, you can look at my ear, you can look at my shoulder, and I don't know, your listener doesn't know that you're not looking in the eyes, but you're still giving me your attention.
Right. And I think the other thing that I'll, in addition to that, because I will talk to, clients about that as well, it is just averting gaze. Like, it's okay to look away for a second, or a few seconds, but we always need to kind of look back at some point and kind of keep checking back. And so sometimes if they're just given kind of that permission that they don't have to look at you the whole time, but that they have to kind of keep looking back, because that's really what we do. I mean, most of the time we don't just look at someone, we do avert our gaze and bring it back, especially if we're thinking, or so giving them that tip too sometimes can help with that.
Good. Let's see, we had a couple of other questions. Some of the questions that we've had, Colleen, have to do with social groups. I talk about things that parents can do at home right now without a group format. I know you have a lot of groups at your practice. Can you talk about the ages and the types of groups that families might expect if they were looking for a social group to build some skills?
Sure. So our groups, generally, we've had some preschool groups at different times. We don't currently have any preschool groups right now. So generally, I would say first grade through young adult are the ages for our groups. And we do our groups in kind of a very specific way in terms of how we form our groups. We have kind of a rigorous process in terms of, gathering assessment materials, if they've had evaluations and things like that, IEPs and school information. And what we're really looking for is to identify what their social cognitive level is, and to try to place them and match them based on that, in addition to chronological age. So we don't just group kids by diagnosis or, just the 10 kids that happen to sign up are all in a group together. I mean, we're really intentional about who we match. Our groups tend to be small, 3 to 4. Some of our social theater groups, which is one of our programs, those sometimes are a little larger, like 5 or 6. But generally, we keep them small so they're very individualized, and we're making sure that the kids are kind of working at the same level in terms of their skills. And we found that's been pretty effective. And if a group is matched well, it's a beautiful thing. And often those groups will continue, because as we know, a lot of kids that really struggle with this, it's not like they're looking for an 8-week social skills group to learn how to, ask a friend to play. It's an ongoing process and needs a lot of practice and repetition and an opportunity to kind of work and develop those skills.
I have found kids do need a fair amount of time. It's not a quick fix. It really is an integrative part of the general social development program. So they may be getting some support at school, some individual supports at home, maybe working with a therapist, and then the group is really an adjunct to all of that so that they can learn how to apply some of those skills with their peers. Right. And it does take time, and I do think that it's nice to hear that they matriculate with their peers through the groups. And you can see it, and I do tell parents it is a slower process, but you'll see over time when we look back and say, wow, remember when you first came in and you were not even able to look at the other kids, and now you know all their names and you know things about them. And so it's really nice to see the progression.
I think for a lot of kids, just that sense of belonging and that sense of acceptance, and that they can work on these skills like in a supported, reinforced way. And I want to say kind of the other side thing about, you're right, a lot of schools will do groups. And I think, some of the differences is like schools are not able to sometimes be as particular about how they group kids because they have certain, limits and things they need to do. So that's one thing. But the other thing that's been kind of a side thing is that the parents have really developed relationships over that period of time as well. And I think just seeing like in our waiting room, when we used our waiting room, we, would see just that they feel a lot of support and from each other and engage and kind of use that time. So, I think that's the other piece. And then with parents being there, we're also able to give them the last 10 or 15 minutes of our group is a lot about giving parents information about things that they worked on, what they can practice at home, and things like that, where sometimes schools, I know that communication can be a little more challenging sometimes, to get feedback regarding a group, but private, I think you have more opportunity for that.
Colleen, are you doing any virtual group right now for your practice? Or is that something that maybe could evolve if you get enough people involved? Or how are you seeing that translate? Because that's a different process.
It is.
And one of the things that I've noticed with our younger kids is the elementary age children tend to not translate as well to the virtual, even therapy, as well as maybe the adolescents who are very much more familiar with technology and FaceTime and things of that nature.
Right. Yeah, because we do our groups kind of by semester, when this started, we had existing groups that were running. And so most of those were able to transition to online pretty easily, especially like you mentioned, the middle school, high school, young adult groups did very well. Some of the groups with the younger kids, it has been a little bit more challenging. I think what we've tried to do is just maintain that connection and have more just kind of check-in times where they may do it, one activity together. And, most families and the kids have continued to participate that way with the existing groups. Normally, summer is a really good time for us to start new groups. And so that has been put on hold for now. At least in terms of in-person groups. And we're starting to go back into the office on a very limited basis in July. So we're kind of looking forward to fall, hoping that maybe we'll be able to start some more groups then, given kind of what the situation is, whether those would be online, virtual, or in person.
Okay, great. We do have a question that's been posted here, Colleen. Do you suggest any apps to help create social stories quickly, particularly when families are struggling when things rapidly change? And I can relate to that with a lot of our kids who don't make transitions very well. Sometimes plans get changed at the last minute.
Right. I think if it's an instant thing and there's a lot of, upset or dysregulation, I think the regulation first is kind of, obviously the most important piece. I think processing even a social story, if they're really upset or, is not probably going to work. Social stories are really best used as kind of preemptive sort of things like you had talked about earlier to sort of prepare for what to expect, and also to give them kind of perspective on the situation. So I don't know of an app, but wow, that would be a great app to create.
Great app. I know one of the things we've done with social stories is to help kids. Let's say you're planning for a birthday party, which is a very overwhelming experience for many kids. And recognizing maybe part of some of those social stories is having some flexibility embedded in them. That things might change and we could do it this way or that way, or, things of that nature.
Yeah, I was just talking to a family yesterday, even about teaching that concept of change, that start to kind of name changes that are occurring, even just subtle changes. And so they can start to identify like, oh, this is a change, but this is okay. And we can kind of deal with that change. Sometimes just even understanding that word or that concept or labeling it that way can kind of help over time for them to develop more tolerance for unexpected change. It's a difficult.
It is difficult.
Yeah.
Do you have any suggestions? We talked about, Colleen, backstage, you and I were talking about the term unexpected and expected as part of the social thinking curriculum and how that might be misused. Because I know they use that term in some of the school programs. And I've had kids, when I use it in my office, they get very agitated. They're like, I hate when you say unexpected. And I'm like, well, that's the best way to explain what's happening right now. Could you explain those concepts a bit for parents?
I think just to think about it, it's not like a behavioral strategy in terms of teaching or telling a child that what they're doing is wrong, right or wrong. It's more about really the hidden rules of any kind of situation. So something is expected or unexpected depending on where you are, who you're with, what the situation is, what your relationship is with that person. And really, that's what we want kids to start to figure out. And through observation and perspective taking, to start to determine what's expected in this setting, in this situation with this person versus someone else. And, even when I'm starting with kids, we'll start to talk about it and I'll be like, well, what about yelling? Do you think that's expected or unexpected? And I'll kind of test them that way. And right away they'll say, well, that's unexpected. And I'll say, but what if you're at a football game and you're cheering on your team? Oh, okay, so that's expected. So getting them to more, it's really about them understanding the context of where they are and, and working on that observation skills. Like, okay, if they're doing something that isn't expected for the situation you're in, getting them to look around. Is everyone else kind of doing that? Or, is what you're doing different than what everyone else is doing? So if you're doing that and everyone else is doing this, do you think that's expected or, more getting them to start to read the hidden rules and the environment and situation that they're in. And I think where it sometimes gets a little bit misused and is more used like, that's unexpected, don't do that, that's unexpected. And I think that's why some kids have a reaction to it,
Right. Well, it feels like they're making a mistake rather than pretending, right? Because some of the things are expected in one school environment, like lunchroom behavior might be different than classroom behavior.
Right.
And so that's definitely context dependent.
Right. And I've noticed that we've worked on that even with some of our kids in the waiting room in terms of their waiting room behavior, where they're, taking off their shoes and laying on the couch and, they're in the waiting room. And so, look around, is everyone else doing that? And kind of getting them to figure it out for themselves, I think, more than pointing it out to them,
Right. Well, Colleen, we have, you had mentioned a couple of times that you had some resources. Is there, what I'd like to do is maybe at the end of this talk, if we don't, and I'll leave the opportunity for people that are tuning in now to ask questions in the chat bar. And while we're wrapping up, we can certainly put some of those resources on the posting with the recorded feed. So we'll list those if you want to send those.
I would love to give just a couple links that, for some of those social thinking resources that I think could be really helpful and fun for parents, especially for younger kids. There's the read alouds with some of the supportive materials, or just some of the videos that they may want to watch too. And I think that's a great resource for them to kind of start with.
Is there a particular website they can go to for that, or do you have that listed on your site?
Well, that's on the socialthinking.com website. And I think if you go to the website, you'll see, I think there's a tab or something that says free resources or kind of COVID free resources, something like that. And then there you'll find a variety of things, the read alouds, the videos. And, I think that was a great resource that they put out there for people, free of charge. So.
Great. And if people have additional questions or they're interested in knowing more about the groups, Colleen, how can they get in contact with you? And we'll be certain to put that on our posting as well on the Facebook feed.
Okay, great. Yeah. And we have a website. It's coreconnectioncc.com. And, if you want to link that there, certainly they can reach out to us that way too.
Great. Well, thank you so much. It's a wonderful wealth of information you provided. I hope people are finding it very useful. And please tune in and to our upcoming parenting series. And we're hoping to continue on Wednesdays at 3 o'clock. And we will be sure to get any additional resources that Colleen comes up with and get those on the site. And if you have questions, you can post them as well, and we'll make sure to follow up with you. Thank you, everyone, for tuning in today.
Great.
And thank you very much, Colleen, for being part of this today.
Thanks, Lisa. Take care.
Bye-bye.